2. Do we really want to be happy? A very nice thing about changing your misbeliefs in order to be a happier person is that it will work for you now. You don't have to wait for months and years for a grand breakthrough. You can begin to change negative and unwanted persistent feelings immediately. You have an advantage in working with a book like this. A misbelief that is frequently encountered in psychotherapy is that it is the therapist's job to make the client a well-adjusted and happy person. Sometimes we expect a psychotherapist to treat us the same way a medical doctor does. You go to his office, present your body and your symptoms, and he diagnoses your condition and prescribes proper treatment. Maybe you require medication or surgery. He puts you in the hospital. He operates. You take your medication, rest properly, and soon you're much better. Learning to be a happy, adjusted, productive, and attractive person cannot be done for you in this way. Your therapist can't do it for you. He or she can't push a button and presto, you're no longer depressed or anxious. It takes work on your part to be happy. With Misbelief Therapy, the client is informed immediately that the plan of action involves his hard work at changing the lies and misbeliefs which have victimized him. Reading this book won't make you a different person, but doing something about what you read here will. We hope you have decided that you can change your emotions. You can be an adjusted and happy human being, no matter what you have experienced in your life, and no matter what your circumstances are. But I can't change the way I believe. Some patients have no trouble accepting the truth that what they tell themselves makes them feel and act the way they do. But they may argue, that's fine for you, a therapist, to say, but I can't change the way I am. The misbelief is, others can be happy, others can have an experience with God, others can correct and change their misbeliefs, others can be free from anxiety, depression, and anger, but I can't. Perhaps they have learned to believe these lies through critical and fault-finding parents, or maybe they have formed habits of comparing themselves to others and believing they come out on the short end. There may be many causes for such misbeliefs. The chemical dependent believes he can't quit using drugs. The obese patient believes he cannot lose weight. The depressive neurotic says, I can't help myself. I can't, even if other people can, are crippling words. Changing your misbeliefs will change your feelings and actions. You can do it. There may be some things in life you actually cannot do. Perhaps you cannot run a 4-minute mile, hit a home run over the ballpark fence, or kick a football 60 yards. But you can change your misbeliefs. You may say to yourself, misbelief therapy may work for others, but it won't work for me. I've tried everything, and I can't make anything work in my life. Are you saying something like that? Let's change that misbelief right now. As long as you're convinced that you can't change, you won't try. There have been many people who have believed they could never change. And yet, these same people have dug in and changed their misbeliefs in spite of themselves, and the result has been transformed lives. Misbelief therapy will work for you. It will work for you even if nothing else has, because its effectiveness depends upon very explicit psychological laws which are as universal as the law of gravity. The law of gravity is evident when you drop something, causing it to fall straight toward the center of the earth. So it is with the laws governing the relationship between belief and behavior. What you believe affects how you behave. Our early years. We talked earlier about the misbelief that all our problems stem from our childhood. This belief is widespread, largely because of the influence of Freudian psychoanalytic theory, a magnificent but frequently erroneous personality theory, which, a few decades ago, was generally accepted as the definitive word about human behavior. Now, however, psychoanalysis is not nearly as universally accepted among psychologists, and is losing ground among psychiatrists. Many excellent scientific investigations have demonstrated that it is entirely unnecessary to uncover the childhood antecedents of current behaviors in order to change them. Freudian psychoanalysis may actually provide an exercise to avoid working on changing behavior. This is not to say that a problem is not better understood by looking into its history. Most therapists engage in exploration of the patient's past because it's important to a certain degree. We began thinking the way we now think at some time or another in our lives, and often our thoughts and beliefs originate in childhood. Some of the primitive beliefs and behaviors that cause our unpleasant feelings and maladaptive behavior as adults were acquired in our early years. They may have been conveyed to us through the behavior and words of a significant person in our childhood. The impressions we learned in early years are important to us in order that we may change the misbeliefs we incurred then, as well as the current misbeliefs we may have about our childhood. Examining your early years may be important for the following reasons. 1. To discover your misbeliefs learned in childhood. 2. To discover your misbeliefs about events in your childhood. 3. To examine your self-talk. What did you tell yourself then? What do you tell yourself now? When you were a child, you may have thought it was terrible if you lost something, or if someone was cruel to you, mistreated you, or treated you unjustly. Examining your early self-talk may reveal some of your current misbeliefs. Once these are discovered, you can go to work changing your present thoughts and attitudes. By working on the lies you tell yourself now, you can successfully learn how to be a happy person in spite of anything that has happened to you in your life. What causes us to feel the way we feel? The state of your biochemistry can affect the way you feel. There are ways to change your biochemistry. One of the ways is through drugs. Another way to change is to begin maintaining an adequate nutritional base and a properly functioning body. Your thoughts, too, can change your biochemistry. That's right. What you are thinking right now can actually change the chemical composition of your brain cells and the rest of your central nervous system. Would you believe that the sentences in your self-talk can actually alter your glandular, muscular, and neural behavior? It's true. That's what we mean when we talk about emotions. Some psychologists are uncovering the fact that the way you think influences the way you feel. They speak of it as a brand new discovery, a modern-day revelation. Actually, this truth has been around for thousands of years. The book of Proverbs says, "As he thinketh in his own heart, so is he," and "the thoughts of the righteous are right." And the book of Psalms gives us many words regarding man's thoughts and the material he puts into his mind. "I thought on my ways, and turned my feet unto thy testimonies." Our thoughts determine our behavior. When we speak of behavior, we mean not only our actions, but also our emotions. Jesus kept telling people to believe, believe. Have faith, trust, believe. According to your faith, be it unto you, he said. Faith is a noun that refers to the act of believing. Jesus' statement clearly teaches that we can expect certain things in our lives to take place as a direct result of how we believe. What if you believe your life is hopeless and that you're nothing but a failure? According to your faith, so be it done to you, is what Jesus said. What if you believe that in spite of the ups and downs of life, you are not a failure? You'll never be a failure. It's impossible for you to be a failure. What if you believe that life is challenging and good, and with Christ as the strength of your life, you're a winner through thick and thin? According to your faith, be it unto you. Don't let anybody tell you that what you think or tell yourself isn't important. It was the main core of Jesus' teachings. During the 1970s, many experiments in psychology were done to demonstrate that changing misbeliefs resulted in changing feelings like fear and depression. Psychologists have spoken of cognitive restructuring, or rational emotive psychotherapy, or alteration of personal constructs. No matter which term the psychologists prefer, they are all excited about one major discovery, a fact which has long been known to wise men, including the authors of the scriptures. Change a man's beliefs, and you will change his feelings and behavior. In order to accomplish our goals in this book and in life, we must systematically discover, analyze, argue against, and replace with truth the misbeliefs in our lives. Before starting, however, you will have to answer the question, do you really want to be happy? If the answer is yes, then move on to the next chapter of this book and the next chapter of your life.